This is the Voice of Early Childhood podcast. A big hello to the Voice of Early Childhood community. I'm the founder, Angelica Salinska, and I have a very special announcement for you all. Our 2026 conference page is all launched and ready for you. We have launched the tickets early to give everyone plenty of time to plan and book. So our conference is on the 7th of March 2026 in Nottingham. We listened to your feedback and we have the speakers back again that you are blown away by and wanted to hear more from. We have Matt Baller returning and sharing his insightful work and practice around promoting children's mental health. And of course, Olivia Corbin-Phillip coming back again, this time bringing books to life. We also have our long-awaited guest, Cheryl Warren, joining us to discuss her area of expertise on neurodiversity. We will be sharing the remaining speakers soon, so keep an eye out on the conference page. You can find the link in this episode description. Tickets are already selling, so don't miss out and grab yours. I look forward to welcoming you all. Hello to all of our listeners and viewers. Welcome to another podcast episode of the Voice of Early Childhood podcast. Just realised I said podcast there twice. That sounds a bit odd, but never mind. My name is Angelica Salinska and I'm your host. And this episode is a little different and very much needed, though, all about air quality. So today I have Anne Marie McConway joining me, who is an early childhood tutor at CEU Coventry, teaching the Early Childhood Development and Learning undergraduate degree. She's also has been a primary school teacher for 9 years. She moved into higher education in 2015 and worked on the National Institute of Teaching and Education team at Coventry University, offering online content for the primary PGCE course on the Future Learn platform and working as an initial teacher training tutor as well. So lots of things there. But then since experiencing long COVID herself, Anne became an advocate for the charity Long COVID Kids and a campaigner for improving indoor air quality in all public spaces, including educational settings, which is what we're really going to be talking about mainly today. So thank you very much, Anne, for joining to share both your knowledge and your own personal experience here as well.
Thank you. Thanks for having me.
Also, a big thank you to Long COVID Kids charity for sponsoring this podcast episode. So Long COVID Kids is a research, advocacy and support and awareness organisation for children with long COVID. The organisation actively raises awareness of the symptoms of long COVID and related illnesses in children to increase understanding, aid early diagnosis and improve response and intervention. They also support children living with long COVID and fund and participate in global research to investigate health implications, improve the lived experience and enable recovery. So really, really vital work there. And you can find, everyone listening and viewing, you can find found out more about Long COVID Kids in this episode description. So lots of kind of background information there, so we know where we're kind of starting from. So Anne's article is titled, really love the title by the way, Anne, A Breath of Fresh Air, Reducing Illness in Early Year Settings by Improving Indoor Air Quality. Everyone, again, viewing, listening, you can find a link to the article in this episode description. And today we're going to be basically digging deeper into the content of the article in this podcast episode. So let's begin with what might seem to be a really simple question. Why indoor air quality matters in early childhood settings? Why does it matter?
Okay. Indoor air quality is hugely important for overall health and well-being of everybody in the setting. It's become more of a focus since COVID hit in 2020, and I think what has happened is that it has revealed a blind spot that we all, I think, didn't really know about. Certainly for myself, I was unaware of the importance of indoor air quality when I was teaching in schools in England. So since the beginning of COVID, we really there has been a huge a huge amount of new research and evidence that has shown us the importance of indoor air quality. And there is strong evidence that tackling poor indoor air quality should be a priority for all of us. We know that people who are working with young children are more likely to be exposed to illness than the general population. So following the evidence that shows us that improving indoor air quality will improve health really needs to be something that is top of the agenda now. So yeah, it's something that I think we didn't necessarily think about, and I would argue we still don't think about enough. It refers essentially to the condition of the air inside a building, and what I am hoping to talk about here is how important it is that we start thinking about monitoring and improving the indoor air quality.
Yeah. And I know you mentioned COVID-19 there, but let's just kind of again set the scene, continuing with that. Whichever diseases are airborne as well, whichever things do we need to be concerned about? Because I think the danger here in terms of people not really taking this on board as much as they should, perhaps, like you said, we've had that lack of awareness, and then maybe it continues further as well, is that they think, well, we've not had COVID, or we don't really think it affects us, or we'll be fine, kind of thing. But what other diseases are there out there that we need to be thinking about that are airborne as well?
So many of them. From my research, again, I will fully admit and put my hands up and say I didn't know this stuff before I became ill and before I developed long COVID and became interested in improving the indoor air quality. I had no idea that many, I would say most of the most common childhood illnesses are spread through the air. So just to give you a little list, so we've got flu, we've got whooping cough, RSV, measles, mumps, chickenpox, TB, meningitis, norovirus. All of those and many others are spread through the air. So if we are to improve health outcomes and reduce the amount of illness that children are going to be experiencing, it's going to, with one fell swoop, if you improve the indoor air quality, you will reduce transmission of all of those childhood illnesses. And I did mention in the article there is a persisting myth that children need to have a high exposure, or it's good for children to have lots of exposure to these illnesses and these pathogens in early childhood, which again we are finding is not actually the case. And really the goal should be to reduce the amount of illness children are experiencing in those early years, because in later childhood, if there's a high infectious disease burden in early childhood, the recent studies are showing that it's linked to poorer health in later childhood. It is something that we need to be prioritising if we want the children to be well.
Yes, and you mentioned in your article government guidelines as well. So guidelines do exist. It's just like you mentioned earlier, there is that kind of lack of awareness there. But tell us a little bit about the government guidelines that do exist that we need to be aware of.
Well, if you go to the IPC, the Infection Prevention and Control Guidelines, which are on the government website, they clearly state and recommend that educational settings, and that includes early years settings, are expected to take steps and take action to reduce, to improve, to monitor and improve the air quality, the indoor air quality. That is because many infectious diseases do spread through the air. This guideline has been in existence for a long time and is there for everybody to see, but I would argue most people are unaware that is the expectation. The expectation is, alongside all of the other infection prevention control measures, so cleaning surfaces and all of the other things that we do, to keep things clean in settings and schools. Alongside that, there is the expectation that the air quality would be monitored and improved.
Okay.
That largely isn't happening. And to give a little bit more detail in relation to the guidelines, the guideline BB 101 is the guideline that settings are expected to follow. And within that guideline, they state that we should be using carbon dioxide monitors. And I have got one here, actually, which I was just going to show during the thing. So you can see my carbon dioxide monitor.
Yes, yeah.
And at the moment, it's 764 parts per million in here, which is good air quality. And the ideal would be that everybody in settings and in schools would have one of those CO2 monitors. They would be able to see the air quality, and they would keep the air quality at or below 800 parts per million, with the expectation that if it goes above 800, something should be done to improve the ventilation and get air filters to improve the quality of the air. So that expectation is there. It's been there. It's been there for a very long time. But I just think most people aren't aware of it, and don't know that that's what they should be doing.
And so, yeah, like I certainly wasn't aware of this at all. And I've worked in settings, and although I didn't manage and own a setting, I've led the preschool room. I don't remember having a carbon
dioxide monitor?
Monitor. Yeah, don't remember kind of ever seeing one anywhere, to be honest. So yeah, it's something that there's just not enough awareness of out there. So go on. Sorry.
A lot of them were sent out when COVID hit initially. These carbon dioxide monitors, they were sent out by the Department for Education to schools and early years settings. So it is likely that a lot of people have got these carbon dioxide monitors, but they might be in a drawer somewhere,
exactly,
rather than measuring the quality of the indoor air. So it's worth digging them out so that you can have an idea and have a look at what the air quality is within your setting.
And have an understanding of what the numbers mean as well, because there's no point just having it. It's not just it doesn't do anything, does it? If the air quality doesn't like shout at you and beep and saying the air quality is bad, you need to interpret the numbers, right? You
need to interpret the numbers. That's it. And what a lot of studies are doing and have been doing is encouraging educational settings, encouraging them to just get, as the first step, get a carbon dioxide monitor and keep an eye on it. Have a look at the numbers, because it may be that your setting has got good indoor air quality. The evidence tells us that that is not likely, because early education settings and schools often have rooms that have got lots and lots of people in.
Yes.
So if you have a crowded room with, let's say, 30 children in and 2 adults, and maybe the windows also closed, it is very, very likely that your carbon dioxide level is going to be high, because the carbon dioxide level tells you, it gives you an indication of how much exhaled air is in that room. So if you've got a very high carbon dioxide level, you are breathing in more of everybody else's air.
That makes sense.
Which is not good. you don't want that. For all sorts of reasons. But yeah, so it's kind of a proxy measure. It doesn't tell you exactly how many infectious diseases there are floating around in the air. But obviously, if you've got a high CO2 level and you've got lots of exhaled air, and then everybody is sharing that air, the likelihood that the pathogens, whatever they are going to be transmitted are much higher. So that's why we need to be looking at it and be aware of it.
And that guidance that you mentioned, is that like part of England only, Department for Education, did you say, or?
That guideline applies to English schools, I believe. And yeah, as I say, it's so. As somebody who has looked into this quite a lot since 2021, I have tried to find out who is responsible for ensuring that these guidelines are met for infection prevention and control. And the difficulty is that the Department for Education says that settings and schools are responsible for making sure that those guidelines are met. And then if you go to settings and schools, they say, what guidelines?
Yes.
Nobody is enforcing them. So there is
because they're guidelines, that's it, isn't it? It's not statutory. And then so the schools and settings are have so much pressure and so overloaded anyway. Another piece of guidance, they're just going to think, oh yeah, we've opened the windows, we've got some carbon dioxide monitors, tick tick, that's it, that's enough.
Yes. And this is where the understanding and awareness comes in. So people aren't going to see improved ventilation as a priority if they don't understand the harm that it is causing.
Yeah.
People need to understand the problems and be made aware of the public health problem that we're experiencing at the moment, and the impact that it is having in many different ways before they will, because people aren't going to be interested in the solution to a problem if they don't see that there is a problem in the first place.
Yeah.
So
right.
It's the first step is to explain the difficulties. Which hopefully we can do here a little bit.
Yes, yeah. And you mentioned, the problems are, you mentioned these airborne diseases spreading. So let's talk about the problems even more then. If we don't follow the guidelines, which I think we should talk about a little bit more as well, in terms of, there's the carbon dioxide monitors, opening windows. Is there anything else in the guidelines? If we don't follow those, then of course these diseases will spread, but perhaps more from a long COVID perspective, because that's your lived experience. Yes, you might have a disease, then it goes away, but actually that's not the case, is it? There's much bigger impact. That's the point, isn't it?
Absolutely. And that's the viewpoint that I'm coming from. So I can expand on that. There are lots of other reasons as well, which I can touch on. But certainly in terms of long COVID, just to talk about long COVID in children and also in adults, we are seeing an increase in the number of children who are being affected by long COVID. And as you say, when children catch COVID or these other childhood diseases, it may be that acute phase is quite mild. What we're seeing is the chronic illness which is resulting is going under the radar quite a lot at the moment, and certainly from my own experience of having long COVID and being in contact with other people who are experiencing it, but also working with the Long COVID Kids charity, it is an escalating problem. And so, for example, the ONS statistics from March 2024, they demonstrated that information demonstrated that the number of children struggling with long COVID doubled from March 2023 to 2024. So it's not an old problem. It's not something that we can say, oh, well, that was back at the beginning of the pandemic and isn't it great that we've moved on from it? It is an escalating problem. Likewise, there was a recent study that was done in America, and the authors of that study, from their analysis, they're saying that they think that long COVID in children has now surpassed asthma as the most prevalent chronic health condition in American children. So nearly 6 million children in America now who are struggling with long COVID. So it is, these are scary statistics. And I think the feeling is that you kind of want to look away and hope for the best. But in reality, I feel that we have a moral obligation to take action. When you know that there is a problem and you know that it is an escalating problem, and also children are completely reliant on us. The children don't have agency. They can't take these decisions for themselves. They can't clean the air for themselves. Often with early children, they can't open the windows for themselves. They are completely reliant on the adults around them to understand the potential risks for their future health and taking action. So, yes. And also in the article, I also mentioned, because there's lots and lots of studies, I obviously wasn't able to put all of the information in the article, but I did include information just about the impact on the youngest children.
Yes.
there was a study about 1% of all babies who were six months old had to have hospital care for COVID infections between September 23 and April 2024, and 8 of those children died. So this is not something. And that study showed that children who are under 1 were more likely to be hospitalised than people who are over 90. So they're more at risk than the oldest people, which goes against what people would normally think, thinking that the oldest in the population were the most vulnerable. But that study found that, in fact, the youngest are the most vulnerable for hospitalisation. So it's something that that we aren't talking enough about. It is something that it's affecting a lot of children and a lot of families. And as I say, it's COVID infections are still with us. Reinfections can still cause long COVID. So I think action is really the only option.
And I guess the best action we could take, because these diseases are out there, we can catch them. And the best action is by breathing in cleaner air, right? Is there anything else we could be doing, or is this the main thing, really? Because, I mean, this is what we're talking about, but it seems like to me, everything else is just kind of out of our control. Like we can't really control if we catch a disease or not, apart from, the clean air aspect. Because I'm just thinking about children in settings, they're always spreading, they could spread all sorts of things, diseases, because they have, through contact with each other, they put things in their mouths, all these kinds of things, they lick things. So, we can't completely eliminate all of that. That's just natural. That is completely, biological of children, and evolutionary, to taste things and put things in their mouth and explore and play and learn through their senses. Of course, there's an element of trying to limit that as well, because of safety as well. But the biggest thing sounds like it's the clean air aspect.
And you're right, of course, you can't eliminate all risk. That's impossible. And it's not the case that improving ventilation and filtering the air is going to be a panacea. However, there are many studies which show that improving ventilation, monitoring the air and cleaning the air has a significant measurable effect on children's health. That and some of the measurable outcomes will be, for example, attendance. So if there are studies that have been done where they found they found a direct link between improving the air quality and how many sick days the children had.
Of course, that makes sense.
It is possible to measure it. And I don't think I think protection is about layers. So it won't be that if a setting improves the air quality, that will eliminate all diseases. What it will do is it will improve the air quality, and it will lead to from what the studies say, it will lead to a significant decrease in transmission. So it won't be the answer, but what it will be is it will lead to improved health, improved attendance, and there's also other significant improvements in terms of cognition and thinking and learning. There is, of course, also an accessibility element to it. So we know that all children are they are more vulnerable. They're not little adults. So children are more vulnerable to these things. And one of the facts that I heard recently was that children breathe 10,000 litres of air per day. And so they breathe more air than adults relative to their size. So when you're thinking about putting your child into a setting or into a school, I think people think about all the different things that their children need, and settings think about all the things that the children need. But clean air is never on that list. So it's always about, well, let's think about, what resources are we going to give them, and, looking in detail at the menu and all of these things, when really top of that list should be have they got clean air to breathe? Because they breathe 10,000 litres of air a day. And if they don't breathe safe, clean air, that is going to have a detrimental impact on their health. So it won't be the answer to reducing all infectious disease, but it will make a significant difference. So I just don't think that there is an argument for not doing it.
It's something. This is what we can do about protecting ourselves, our children from these debilitating diseases, life-threatening, as you mentioned.
And as I say, it's not just about infectious disease. It is also. So I mean, when I feel guilty about not having looked more into air pollution than I, prior to myself and my family being affected by this. But of course, air quality has been on the agenda for a very long time. And there have been people who have been campaigning to improve air quality, indoor and outdoor air quality, for a very long time, because it's not just about pathogens in the air. It's also about particulate matter and VOCs, and all these are the harmful particles that are in the air, which are having, again, significant impact on children's health. So I'm coming at it from the infectious disease perspective, but there are plenty of other people who are also calling for this, who are coming at it from a different viewpoint, but also, saying that it's going to make a big difference. Because there's lots of children who suffer with, respiratory problems who would benefit massively from filtered air. And all of these things being removed from the air, because air filters, they will remove the infectious, the pathogens, the viral particles, but they also remove allergens, they remove mold, as I say, all of these harmful pollutants. So it's not just there's not just one reason to do this. There's multiple benefits.
Yeah, actually, that's something that I can see in your article, that you pose that question: do air cleaners or air filters actually work? And you give, the reasons for why, and just what you mentioned now, I guess. And it really made me think as well, because actually, I've only about a month ago, I've got an air cleaner for my house, like one of those fan air cleaners. Kind of like a 2-in-1 type thing. And the only reason for that is because my partner's got, this year, it's really, really bad hay fever. And it was just awful. He couldn't even open his eyes at times. So we thought, oh, well, actually, let's look into it and let's get that for that reason. But again, like you, I was thinking, why didn't we do this sooner? Because actually it is cleaning the air. And like you said, mold as well, and pollutants. And I was going to say to you, about that feeling guilty as well, of we don't know what we don't know. So
exactly.
It's just, and exactly what this whole conversation is about in your article and this podcast episode, of awareness. And are we even aware of this guidance? Are we aware of these consequences of not cleaning the air? It's just about having that awareness and being knowledgeable, isn't it?
Well, and also understanding that there is a solution, because I don't feel that people are doing this, are not doing this rather, for any nefarious reasons.
No.
And I think that if people understood that there are tools at our disposal, you can get them really quickly, and you could be doing this, next week if you wanted to. So it's not impossible. And I think, again, it's about understanding how you can achieve this, that it is achievable, and that we don't need to just think, oh, well, it's inevitable. It's what can we do about the air? The air's the air. We can't change the air. Actually, there are things that we could do, and they would make a big difference. And I think that if people know that you don't have to just think, oh, well, be resigned to it and think, oh, well, we all work in education, so we're probably all going to get ill and there's nothing we can do about that. And well, children are all going to share, everyone's going to get it, and we'll all just have to ride it out. The reality is that if you were to do this, it would help massively, and not just in the short term, in the long term. There are long-term benefits to this.
And now we're really talking about what can we do about this. So in your article, you mentioned the 3 essential steps. So would you like to tell us a little bit more about that? And that will really give people insight of what they can do, and, like you say, put things in place straight away as well.
Yeah. So monitor, filter, ventilate. They're the 3 steps. So step 1, get yourself carbon dioxide monitor, as I say here. If you just have them and keep an eye on them, watch the numbers, and then you'll see if you have a problem with your indoor air quality really quickly.
I was just so sorry, quickly going to ask, in terms of looking at the numbers, how do you know what's what? Is there guidance online, and where can you find it? Does it come with the monitor, so you actually know what that number means, if you know what I mean?
Yeah, there is guidance online. I can send you a link to it. So again, on the government website, there's kind of a green, amber, red
perfect.
table that they give you. So the green would be sort of at 800 parts per million or below. Anything between, I mean, this is a bit of a problem as well that we have. So in our guidelines, they have up to 1,500 parts per million, and the advice is anything beyond that, you're going to need to take serious immediate action. And so in between 800 and 1,500, doing all of these things, opening windows, filters, and so on. In other countries, the expectations are I would say better. So France, for example, has legislated, so not guidelines, legislation, so regulations that schools and settings should have 800 parts per million as the threshold. So it shouldn't go beyond that. But yeah, so our expectations, our guidelines are significantly worse than some other countries, but they are what they are. So, but looking at those, you can see where you need to take action. If you're getting up into sort of over 1,000 parts per million, and up to 1,500 is what it says on the website for our from our government. But yeah, that's a separate,
separate conversation.
But thinking about what you can do if you're in your setting or in your school, so get yourself a carbon dioxide monitor. First, most important step, I would say, so you can see the air quality. Obviously, it's only one measure of it. There are other ways of measuring the quality of the air, but looking at the CO2 monitor is a good first step. If you can see that the numbers are too high, then do something about it. Open the windows, open the doors, and sometimes there might be problems with that. We know that some classrooms and some settings maybe don't have windows that open, which is a really difficult situation. So I would see if something can be done about that. But if you so that's the first thing you can do. So that's the ventilating, but also air filters. So looking at HEPA air filters that are available, and choose carefully. I did put a link in the article.
Yes, I can see
Some
that.
are much better than others. So just getting an air filter isn't necessarily going to be, you do have to look carefully at the different ones and how they perform. So that's kind of what you want to do. There are some DIY ones that you can do as well. So there's a thing called a Corsi Rosenthal box, which quite a lot of schools and settings have used. So you can make them, buy the filters yourself, get a fan. I've got one here in the room with me. They are really effective. They can be cheaper than some of the HEPA air filters that you can buy. So there's multiple options. And also getting the children involved, I think, is really important.
That's a good idea.
Yeah, I was just listening to a podcast about a study that has been done in Austria across 1,200 schools, and they had the CO2 monitors that they were in the classrooms that they were monitoring, and they found, as a result of carrying out this study over a year, that the children knew what the numbers should be and were alerting the adults in the room to say, look at the number, we've gone over 1,000, we need to do something, can we open the window please? And so the children were involved in monitoring the air quality for themselves, which I think is just fantastic. But
yeah, definitely, it gives them that ownership of you were saying about we almost have like a duty obligation to children, and it's their rights to have clean air, really, to be breathing clean air. And then it also gives children that ownership of their own lives, essentially their own health. And it is part of, I'd say, like the essentially sustainable, probably be able to link them to sustainable development goals in a way as well. Just changing society and the impact on people's health.
I think that's a key point. That is what's needed. It is about a cultural shift in understanding what we mean by indoor air quality, why it's important, what we can do about it, and prioritising it, rather than thinking, oh, well, if it's the winter, I don't really want to open the windows. I'm cold. But thinking, actually, maybe having a blast of fresh air into the room to improve the indoor air quality is more important than feeling warm at all points.
That's a really good point.
Because sometimes that stops people from ventilating, which is a difficulty, and you have to. I think again that's about people understanding the importance and the significance of breathing safe air.
Yeah, definitely. And I guess we're talking about like clean air quality indoors really, but stepping outside and having more time outdoors is also really important, isn't it? And allowing that for children especially. And I know in Scandinavian countries, maybe other countries as well, a lot of the time they have in their nurseries children sleep outdoors all kind of wrapped up, and because they really understand the importance of fresh air and how healthy that is.
So thinking back, I mentioned in the article, I think I mentioned about Florence Nightingale and her work. So she was one of the first advocates for cleaning the indoor air to reduce infectious disease transmission. Looking at early years pioneers, the Macmillan sisters in the 1918 flu pandemic, they recognised that outdoor early education was going to benefit the children, and they moved their nurseries outdoors and ran these outdoor nurseries, some of which are still, there's certainly nurseries that are based on their approach now and their philosophy, and it led to significant health benefits. The children had less infectious disease. So at that time, of course, they were dealing with TB, more TB, measles, and it was pre-vaccination, and lots of antibiotics and so on. So they had to rely on these non-pharmaceutical interventions. They knew that cleaning the air and fresh air had a significant impact on improved health. We knew that, and I feel that we have forgotten that.
That's very and to be honest, you're so right. I remember studying about the Macmillan sisters myself, and then actually supporting my students' work around them gaining this knowledge around different various pioneers. And we talked about outdoor nurseries, but then we don't link. And I'm such a big advocate for linking theory to practice. And even I didn't think about this right now when we're talking about clean air, because it seems like when we talk about these things, it's very like strategy, procedures based, the things that we're kind of feel like we're removed from, and the perhaps the leadership team will deal with that, or the operations team will deal with that, or like the manager will deal with that, and we don't have to. But I know in your article you talk about the importance of actually leaders training their teams in understanding and managing air quality, and that's so vital. Well, and obviously we talked about children as well, and
absolutely, yeah. And actually a lack of staff training has been the downfall in some studies. So the government in 2021 did the DfE rather in 2021 they did commission a study in Bradford, a clean air, I think it's called the Class Act study, and one of the difficulties that they had in this study was that air filters, HEPA air cleaners, had been put into classrooms, but they weren't always turned on. So you can, because the staff and the children need to understand the benefit of turning that air filter on. You can give somebody the air filter and the CO2 monitor, but without that additional training and education and understanding, it will fail.
Yeah, I can just see it in my head, and I must have heard it before as well, of like, oh, we don't use it, it's too noisy, or we've just got that filter and it's in the corner, or just pop it on because they wanted it on and then we'll just turn it off later. Those kind of excuses of like, we don't really know what it does kind of thing. We just need to turn it on once in a while. Yeah, just to tick the box.
I mean, realistically, and I think so. I did write an article for Teach Primary about this, and And the point, there's kind of overall point that I was making in that article was that this should not be our responsibility, and it should not fall to individual settings and schools to piece together a way of protecting the children in their care and the staff. We shouldn't be in the situation that we are in. We are in that situation, which is why I want to raise awareness and talk about it. But ideally, what should be happening is we should have improved regulation, and the evidence that we have now about poor indoor air quality should be driving governmental action and change. Yeah. That's what ought to be happening. In the interim, while we wait for that to happen, we need to do these things for ourselves, because we are seeing the ongoing impact of the attendance crisis that we're seeing. The primary driver of absence in schools is illness, and it's 40% higher. It's consistently sustained. It stayed at a higher rate since the beginning of the pandemic, and it has not come down. And it can be reduced. We can see that this burden of increased illness it could be reduced. We could be making a difference by improving the indoor air quality. We could be reducing illness, which would have an impact on attendance. And I think in the early years sector, because I mentioned in the article, it is different in the early years sector. It's different to schools. We don't have those statistics being collected. It will be largely invisible, and settings will be absorbing the cost. The government pay for supply teachers, and that comes out of the budget that the government have. All of the illness and absence in the early years sector is going to be absorbed by the private nurseries, by businesses. The majority of the early years sector is the PVI, so they're going to be absorbing this cost, and we'll know that this is happening. I do feel like the early years sector are uniquely positioned to take action in this area in a way that schools aren't, because of the diversity of the sector, and also the need to I suppose appeal to parents and have that, because it's a competitive landscape. Saying to parents that we're going to make sure that your children have got safe air and high quality air that they're breathing. I think that there are more there's more room really for innovation in the early years sector, and to act more quickly, more
flexibility as well, like we were saying about outdoor forest schools, sleeping arrangements, all sorts of things like that as well. And what else was I going to say? That really made me think what you were saying there at the end. Oh, I guess, it's a competitive edge, like you write in your article as well, actually. It's that kind of message of reassuring families that you care about their child, and you're being proactive and protecting their child's health. But actually, clean air should not be a selling point. Clean air should just be the norm, which is crazy, isn't it?
I agree. It shouldn't. And it's also going to compound inequality, because you're going to have, and you already do have, this gap that obviously we already have and know about the inequality gap, but it's going to, by doing this in a piecemeal way, which is what's happening at the moment, it will exacerbate that inequality, because you will have some settings where they are embracing this, realising that something needs to change. Maybe they've got the funds to do it, and they will improve their indoor air quality. And then you will have other children in other settings. Maybe they can't, the people that run their setting don't know about it yet, or don't understand the benefits of it, or that it's not a cost, it's an investment, so they haven't done it yet. So you're going to have some children that are getting improved indoor air quality and others who aren't. So I totally agree that this should not be where we are, and that all children have a right to breathe clean air when they are in an educational setting. We are where we are. And so yeah, I totally agree with you that this needs to be something that happens at a higher level, and the Department for Education need to raise awareness about the importance of this and start checking whether or not these guidelines are being met. But as I say, it's not. It is a blind spot that everybody across the board has got.
Yeah.
And not just in our country, in all countries. This is something that I think the pandemic has brought into focus, is that we are not focusing on good indoor air quality, and the impact of that we are seeing now with the number of children who are suffering with long COVID worldwide. So yeah, I mean, it's sort of frustrating because it is something that should already have happened. But there are lots of really good examples that are happening at the moment. There are initiatives that are popping up around the country. So Hertfordshire County Council have invested in some air filters in their schools, and they are measuring the benefits of that. Although there's some question marks over the filters that they've used, but they're starting to do something. They're starting to listen. There's a pilot in London. 200 schools are going to get air filters there. There's a new initiative in Bristol called Clean Air for Kids, where campaigners are trying to get Bristol, County Council on board to start taking action for children in Bristol. So it's something that is building
slowly.
Way too slowly. But yeah, I think the more people understand the health, the serious health concerns that our children are facing, that they don't need to be facing, because there's things that we could be doing, and the more parents realise, I think, hopefully change will start happening.
Because parents then can make more of a noise about it and demand this. And there's a lot of parents out there, in all of society. We're not just thinking we're in education here and we need to fight this fight alone. Actually, there are, like I say, parents in every industry, and it's about. Well, I guess what we often talk about on the Voice of Early Childhood podcast and conferences and beyond is it's all about coming together, isn't it? And kind of really collaborating on things like this, which probably now links nicely kind of to wrapping up this episode. And now that we're finishing off on a more positive note, that you mentioned the fact that things are happening, and people and organizations are starting to make changes. So for everyone who's listening and watching, we've published together with Anne and Long COVID Kids Charity a clean air guide for early years settings. And this guide is free to download for everyone, so free to access. Just click on the link in this episode description to get a copy delivered straight to your emails. And remember, this guidance, of course, applies to schools as well and other education settings. It all depends, how you apply it into your context. So do access that resource. And of course, Anne's article, so you can read Anne's article. The link is also available in this episode description. And of course, the link to find out more about the charity Long COVID Kids is also in this episode description. So do take a look at that. And in the article, it's available there too. So lots more information that you can find out. And I've got to say also, Anne, your article has lots of references and further reading, which is fantastic as well. It's brilliant. So there's a lot that people can, raise their awareness on. There's so much information there, and it's great that you've come on and actually are raising so much more awareness with this together with the Long COVID Kids Charity. So thank you for that. I think a lot of people need to be thankful to you and the charity as well.
Well, there's lots of people who are trying to sort of raise awareness and sound the alarm really about this. So yeah, it's I'm hopeful. I'm hopeful that change is going to happen. And I think and thank you to you for allowing me to join you on the podcast and for spreading the message about cleaning the air. It's really important, and so thank you very much.
Yeah, very, very vital. Yeah, and looking forward to hearing more about this and more positive change coming soon, hopefully.